Earlier this week, Canada lost its measles elimination status, which some health experts have described as a wake-up call. Let's discuss with Dr. Nicola Mercer, the Medical Officer of Health in Wellington, Dufferin, Guelph. Hi, Dr. Mercer.
And thanks for having me.
Can you talk about what this means, not only on the national level, but also what it means here at a local level?
Yeah, it's a really good question. So what it means when you have lost your status, it means that a country has ongoing transmission of the measles virus. And what we've had in Canada now for about a year is people have been getting measles, not just in our local area, but all across Ontario and across Canada. And when we look genetically at what that virus was, we could tell it's the exact same strain. So it tells us that as a country that we've been having ongoing transmission of measles, the same measles virus from person to person across Canada of people who are susceptible to the virus. So what it means for the country as a whole is, unfortunately, we have lost our designation as a country where you can't get measles. So for people who come to Canada now, they'll be told you could get measles if you come to Canada. And for locally, what it means, if you're raising your family, if you or your family are not vaccinated for measles, it means you could go to someplace, you could holiday in Canada, and you could potentially get measles.
We've heard this news described as embarrassing, as a shock, as a surprise. How does it come to you?
Well, it wasn't actually a surprise for me. In fact, I probably would have been more surprised if we hadn't have lost our measles elimination status. And that's because it's been ongoing for about a year now. We've had so many cases pop up here and there across Canada that, again, this ongoing transmission was very concerning. So yeah, not a surprise for me. Is it disappointing? Yes, very disappointing, because measles is actually entirely preventable with a vaccine.
And we have had, of course, multiple conversations about the importance of getting vaccinated against measles and many other diseases as well. Do we know at this point what vaccination rate is needed in order to prevent measles outbreaks from happening?
Yeah, measles is one of the most highly transmissible diseases that we have out there. And so because it's very transmissible, we need actually really high rates of vaccination in order to prevent it from going to person. So even 95% may not even be enough, probably closer to 98%. So if your child is not vaccinated and they're going to a school where the vaccination rate within that school is below 95%, it means a case of measles in that school could easily have, in fact, every child within that school who's susceptible who is not vaccinated.
Now, some critics have linked the loss to issues within provincial authorities like public health funding cuts or the family doctor crisis. What's your response to these types of concerns at this time?
Well, I'm a medical officer of health, which means that I have an area within the province of Ontario that I look after. So I take seriously, it's a responsibility that I take seriously in order to ensure that we provide the vaccine to school children, that we make sure parents know whether their child is vaccinated or not. So that's sort of what I say is on me. In terms of the family doctor crisis in particular, I think that this is likely to be another component that would improve our vaccination rate. So for people who are hesitant about vaccines broadly, not just the measles vaccine, but if you have questions and you don't have anybody that you trust that you can ask those questions to, then you may go to untrustworthy sites, friends or relatives who may be well-meaning but don't give you correct information, or perhaps on the internet where there's a whole bunch of information that's just not correct. So I do think not having a family physician or a primary care provider to answer those questions is a part of the puzzle that, when we fix that, will also help our vaccination rates.
For people wondering, where do we go from here? What needs to be done in order to get the elimination status back?
This can be brought back. So what we need to do is we need to have 12 months with no transmission, ongoing transmission. So of course, cases of measles will always come to Canada from other countries. That happens. It happens all the time. But as long as there's no spread within Canada, then we can get this back. So it's going to take at least a year. But more importantly, it's going to take a lot more vaccines to go into the arms of people who right now are not vaccinated or have declined vaccination, or maybe there are people who just don't even know that they haven't been vaccinated as a child. So it's going to take a lot of work, and I don't expect that we'll get it back maybe in a year, but we will get this vaccination elimination status back. I just think it's going to take a lot of effort on the part of many health officials and many primary care providers all across Canada.
One step at a time. Thank you for breaking this down for us, Dr. Mercer. Dr. Nicola Mercer is the Medical Officer of Health in Wellington, Dufferin, Guelph. Thanks again.
And thank you.